Welcome to your most favorite channel, Heartbeat. This channel is mainly meant for MBBS students and medical professionals. My name is Dr. Amrit Kejriwal, and I am teaching mainly general medicine and applied medicine. As it is said, I learnt a lot from my teachers. I learnt a bit more from my colleagues, but the most I learned from my students. And I'm still learning, and I still consider myself to be a student of medicine. Today we'll discuss cardiac murmurs, why they originate, and I personally call this the classroom module. It is becomes a bit easier to understand what the activities in the left ventricle, why we get aortic regurgitation murmur, aortic stenosis murmur, mitral regurgitation murmur, and mitral stenosis murmur. When I was a student, I always used to get confused why aortic stenosis murmur is systolic and why a mitral stenosis murmur is diastolic. Both are stenosis. Aortic stenosis murmur will occur when the aortic valve is open, and mitral stenosis murmur will occur when the mitral valve should be open. Let us just go into the classroom module. It gives a better understanding. There are some basic fundamentals before we go into the classroom module. A pressure gradient has to exist for blood flow. The direction of the blood flow will depend upon the pressure gradient. Stenosis is a pathology of the open valve. So the mitral valve is open in the diastole, ventricular diastole. So whatever murmurs you hear mainly of mitral stenosis will be heard in the ventricular diastole. Regurgitation is a pathology of closed valve, and mitral valve is closed during the ventricular systole. So whatever pathology of mitral valve you will hear regarding regurgitation, you will hear mainly in the systole. One, see, this should have been closed. The exit point should have closed and no people could have come from here. At stage 2, see, this should have been closed, but it's open, and this is also closed, mitral valve. Stage 3, aortic stenosis. See, the leaflets were completely open. Now the leaflets are totally closed. What happened in stage 4? See, this is totally closed. This is also closed, and in aortic agitation. And then we come back to stage 1, where the leaflets remain open and this remains closed. Now we'll go on to mitral stenosis. 3 arrows are here, only 1 arrow here, 1 arrow here. So the blood flow is restricted over here in mitral stenosis. Valve opening is restricted. Our patient, over here the blood goes out, and it should have been completely closed, but it's going out, and this remains closed. And the walls are thickened. Just see, yeah, stage 3. In stage 4, blood can still go out from this. Stage 4, this corresponds to stage 4 when these leaflets are closed and blood can still go out. So it causes murmurs, which is stage 2, stage 3, stage 4. Stage 2 beginning the aortic, there was no entry. Stage 3 there was exit only. Stage 4 again there is no exit at all. So this corresponds to stage 4. Let's see, yeah, see the leaflets, they're totally closed in this. See, very little blood can go out now. See how here blood can come back in. Yeah, blood comes back in. This remains open and blood can go into the retrograde blood flow.